Warning, the information and interviews shared on this program might be found to be quite useful.
Hi there, it's great to see you again. I'm Sherrie Dunlevy.
And I'm Tate Blanchard, and we want to welcome you to another great episode of For Mature Audiences. In today's episode, we want to provide you with a lot of information, so you might want to go and get a pen and pad and take some notes.
That's right, Tate, because you know what? Today we're going to be talking about hospice care and palliative care. And no, these two are not interchangeable. They are completely different.
In fact, there are a lot of myths surrounding both of these types of services, and that's exactly why we wanted to spend time talking about that today and letting you know about the different services that they provide to patients and their families. So when it's time for you to make those difficult decisions, you'll be able to make them based on this information.
So are you living with a serious condition such as cancer, COPD, or congestive heart failure? Have you been in and out of the ER in the past year or so many times? And are you always making frequent calls to your doctor? Are you needing to have help when managing your health care? Are you wanting a better quality of life?
And if you answered yes to one or more of these questions, then this segment contains important information for you today.
That's right, because we're going to be talking about palliative care. This is a service that's helping patients across the nation manage their chronic health conditions, and it just may be able to help you too.
That's right. Palliative care is a term that is relatively new here in the Ohio Valley, and perhaps you've heard of it and maybe you haven't, but there might be a lot of information that you're not quite sure of, and we're going to help you out with that today.
I had a chance to sit down with Marissa Javocic from Caring Connections and talk about palliative care and all of the benefits that it can provide to people right here in our community. Marissa breaks down what palliative care is and who it's for and how it can help.
The nurse practitioner is going to come into the home and help the patient identify things that maybe are just in their environment. So, things outside of just medications that can help limit their symptoms or help them cope with their symptoms, while also discussing, maybe how are you using the medications that your doctor has provided to help control those symptoms a little bit better. Because as we know, we go to the office and they give us these medications, and then we go home and we say, what do we do with them? Or how do we take those inhalers? Or how do I even set up this oxygen? So having a provider there in the comfort of a patient's home to help go through those struggles as their disease does progress and they do have more symptoms.
Is it really just helping? Is palliative care really just helping sort out the medications?
So we're there for symptom control, but another big aspect of our care is actually discussing our goals of care. And what's the patient's wishes and what's important to them. And part of that discussion is also talking about advanced directives and, what type of care do they want down the road? And have they filled out a living will, or do they have a medical power of attorney to help them make those decisions if they're not able to make them in the future? And that's a huge component of palliative care as well, is just sitting down and really taking time with a patient to hear what their wishes are and what's important to them and relaying that to their healthcare team.
So do they look at, so you have palliative care, then are they in contact with your medical team then?
Absolutely. So those patients continue to follow with their specialists as well as their family doctor. We are, like I said, another layer of support for these patients. We're consultative. So we may identify a need in the home, but we're going to go back to that patient's primary team of physicians to continue that care with them and to get the changes made that the patient needs to be able to stay in the home and out of the hospital.
And are a lot of the physicians on board with this? What are physicians liking about this?
Well, physicians are liking about this is keeping their patients out of the hospital. That's the biggest benefit, that they have eyes and ears in the patient's home to help them know what exactly is happening there. That's, being a struggle for the patient, and also helping them so they don't have to go in and out of the doctor's office so much, and not having to maybe have a visit every other week, which is really difficult for some of our patients that are having a hard time getting out of the house. So yes, it's been well received by our physicians. I will say it's a learning curve for all of us, right? As we spoke earlier, this is a new program to our area. So not only are, providers being educated about it, but also our community.
How is this paid for?
So this is paid for by your medical insurance. So for Medicare patients, those that are 65 and older, it's a Medicare Part B benefit. So it's typically seen as like you would see your specialists. So if you would go to the heart doctor or a lung doctor, it's seen by insurance in the same realm of specialty type care.
Okay, so I know that a lot of physicians will sit down with, a family, and they'll talk to them and they'll say, this might be a good time to call in hospice. Are physicians also leading the charge to say this might be a good time to call in palliative care? Or can people just, how would you know when it's time?
That's a great question. So yes, our goal is for providers to reach out to our patients, and tell them, what, this would be a really great program. However, patients and family members can also reach out and they can say, my loved one is struggling at home. They have a lot of symptoms. They have heart failure, lung disease, or maybe cancer that they're getting treatment for. And they're having a lot of symptoms related to that. And we just need more help. We need somebody to help us at home manage these symptoms better because, we've been in and out of the hospital or just struggling, just not having a great quality of life. What we will do as a palliative care program is we will then reach out to their care team, whether it be their family doctor or their specialist, and say, hey, this family member has reached out and their loved one is really struggling at home and they would like some extra assistance in the home with palliative care, and we'll get their medical records to be able to go and see that patient at home.
Mm-hmm. So how does this help? I know how it helps the patient. How does it help the family members with the patient? Because a lot of times, a lot of these things are, they're far reaching.
Number one, it's an access person, right? This is a medical provider that they can have and they can call and ask questions for. We're nurse practitioners that go to the home, and we can help educate the family as well as the patient as to the disease progression and why they're having these symptoms. We also have social workers that are available on an as-needed basis to go see the patient and help provide emotional support, which can be a huge benefit for not only the patients, but the families as well that are struggling with just the emotional component of disease progression and chronic illness.
I think that it's a great resource to have to help people sort things out because, all the different things that happen and all the different doctors that you're going to, all the different medications, it can become very overwhelming. So like your palliative care nurse practitioner is kind of like your point person, right?
Yeah. So, we're well versed in chronic illnesses and being able to help provide that education to patients and to bounce, what is this disease and what are these treatments, and help being that point person and education person in the homes to help patients work through these maybe new diagnoses or really complex diagnoses alongside with their specialty team.
If you would like more information on palliative care, you can contact Marissa or a member of her staff at Caring Connections. The number to call is 740-859-5655.
Up next on For Mature Audiences, we're going to dispel a lot of myths surrounding hospice care by providing you with information that every person should have. Stay with us.
From humble beginnings in 1837, West Liberty University has been home to thousands of students. Whether you're a recent high school graduate or looking to complete a college degree later in life, starting your educational career at West Liberty University will be the catalyst for your future. This is a place where you will discover who you are and where you belong, surrounded by lifelong friends and a supportive faculty and staff. Start your journey home at westliberty.edu.
Welcome back to For Mature Audiences. Right now, we're going to be talking about a subject that can be one that a lot of people have trouble talking about.
And that's exactly right. We feel that this subject is one that everyone should have a conversation with those they love, and the subject is hospice care.
That's right. And so many people assume that hospice is called when you have, days or weeks or hours or minutes to live. And that's just one of the many myths surrounding hospice care.
That's why we wanted to have an in-depth discussion about hospice. Sherrie had the chance to sit down with Trisha Painter from Amedysis Hospice and have a discussion that covers all of the bases. We hope that you'll take the time to listen and learn about what this service could provide for you or someone you love who is struggling with an incurable illness. You may find that hospice could have or could be the answer to your prayers.
Hospice, as you said, a lot of people are afraid of it. And it's a service that we find once we're in the home. Most patients and families will say, I wish I knew about you sooner. So with hospice, you really want to learn about the facts because there's a lot of myths about hospice care that they're dying right away. It's for patients that have end of life symptoms, and there's nothing that you can actually do to cure it. So some of these are COPD, congestive heart failure, dementia. And what we do is a whole team approach with social workers, chaplains, nurses, aides, and we all come together to develop a care plan to help this patient stay at home where they want to be and have quality days that they have left.
So how do we know when it's time to call?
So usually, a family is usually seeing a lot of hospital admissions, and those hospital admissions seem to be getting closer and closer together, or they're having a lot more calls to the physician's office. They're calling in because they don't know how to treat certain symptoms, and they're trying to get the doctor to give another order, but they can't get mom or dad into the doctor's office anymore because it's too hard. They physically cannot do it because of the physical decline. So when you start seeing any symptoms like that, it's probably time to at least have the conversation about hospice and then determine if maybe that's going to be the best part of care for you at this point in time.
I think hospice is so scary to people because everyone holds out hope that people are going to rally and they're going to beat this and they're going to get better. And this is almost like putting up the white flag of surrender.
Yeah, I hear that a lot, Sherrie. Actually, with hospice, we never want to take away that hope. You can leave hospice anytime you want to. So if this wonderful cure comes out for whatever you have, we encourage you to go ahead and revoke the hospice benefit and go and try that treatment. We also have some patients that do graduate from hospice. With the care that we have been providing with hospice, we pay for the medications related to the hospice diagnosis. We set their pills out and for all week. So when they're taking their pills correctly and actually getting their pills from the pharmacy, some conditions you may see a little bit of improvement, and that's when we have to graduate them from hospice.
What I would love for people to know about hospice is it's not just for the person, the patient, that hospice can be such a relief for the other family members. So explain that. How does that happen?
Absolutely. So with hospice, like I said, we have a whole team approach, but right in the middle is patient and family. It's not just patient-centered. It's really, really hard to be a caregiver. And until you have done it, you don't quite understand it. Caregivers are exhausted taking care of a loved one. So, with our help, our education, our support, these caregivers are able to keep their loved one at home as that is their wish. And they know that they can call us at any time, even if it's 2 in the morning or it's Christmas Day. They can call us, they can ask us their question, we will answer it. But if they even need a visit and want us to come out, we'll go out and make that visit. Sometimes I think of it as a little bit of a mobile ER because we're going to come to them instead of making them go out.
And so this does bring peace of mind to the family. So you were saying like you have this whole team approach. So who all is involved in touching the patient once you decide that hospice is something that you want to choose for your loved one?
So, as I was saying, the whole team approach is first we have our hospice medical director, and we are able to reach our medical directors at any time. If we have a symptom out of control, we can reach them. Then you have a case manager that is an RN, and that RN really gets to know the patient and family. They almost become family with the patient. They get so close to them. They know what's helping them, what's not helping them. So they will see that nurse regularly. And then also there's aides that will come in with help with personal hygiene. And that really benefits the family, especially if it's an elderly husband or wife trying to care for the spouse. It's hard for them to bathe somebody. So our aides will come in, perform the bathing and hygiene. We also have a social worker and a chaplain to help with the psychosocial support and the spiritual support for the patients.
Those two ingredients right there at the end, the psychosocial and the spiritual, really can help not just the patient, but the family come to terms with what's really happening.
Absolutely. And they build that trust with the social worker and the chaplain. We find many times there is something deep down inside that patient is struggling with. And with these conversations, our chaplain and social workers are able to help that patient go through what is bothering them so that way they don't have that burden on them anymore. And same way with family, sometimes families will feel guilty about, like you said, hospice, or maybe they have to put them in a long-term care facility. So our social worker and chaplain's able to work with them also. Medicare Part A is what covers hospice, and it covers it at 100%. I know a lot of people are always worried, how much will it cost me, especially with insurances. Hospice is a benefit that people have paid into, and they have the right to it, and it's 100%, and that includes the whole team that I mentioned. It covers any medications related to the hospice diagnosis, including signs and symptoms, any medical equipment that's needed in the home. We want to make your home accessible in order to be able to take care of that patient. So if they need a hospital bed or they need oxygen or a wheelchair, bedside commode, we can get those items. And another big item that a lot of families really appreciate is that we also pay for depends, and those can get quite expensive for a family, but the hospice benefit does pay for that. The other part with a hospice benefit is, like we said, being a caregiver is very exhausting. There is a respite benefit. If you are a caregiver and you are totally exhausted and burned out, we can place the patient in a facility for 5 nights to give that caregiver a break. They can still go visit them if they want, but at least it's not 24/7 that they're responsible to take care of that patient anymore.
If you'd like more information about hospice, contact Trisha at 304-907-2931.
Now that you're better informed about both palliative care and hospice care, we hope that you'll take the time to sit down with those closest to you and talk about what services you would like or your loved ones would like if they're faced with a chronic or incurable disease.
As someone who can speak on this personally, I have to say that I agree 100% with this. Families who don't talk about this really leave a burden on the person who's left in charge of making that decision. And regardless of what decision you make, you're never sure if it's the right one. And there's a lot of guilt that comes with that. And it's guilt that you can really carry with you for a lifetime.
That's right, Sherrie. And having these conversations makes it clear what steps the family members should be taking to alleviate that uncertainty, which creates peace of mind for all of the folks that are involved. And we feel that it's one of the kindest and greatest gifts that you can leave to those you love.
That's right. And coming up next on For Mature Audiences, it's our Aging Awesomely segment, and we can't wait to introduce you to Jerry and Linda. After all, the couple who plays together stays together.
From humble beginnings in 1837, West Liberty University has been home to thousands of students. Whether you're a recent high school graduate or looking to complete a college degree later in life, starting your educational career at West Liberty University will be the catalyst for your future. This is a place where you will discover who you are and where you belong, surrounded by lifelong friends and a supportive faculty and staff. Start your journey home at westliberty.edu.
Keeping active in things you love to do can keep you young at heart. And that is especially true for this couple who have been making beautiful music together for decades. They are our featured guests in our monthly segment we call Aging Awesomely.
Jerry and Linda Gretchen started playing music as children, but it wasn't until about 20 years ago that they started playing music together. And that love of music and social activity, they say, are two key ingredients that are important if you want to live a healthy, purposeful, and vibrant life. So welcome so much. I'm so glad you're here, Linda and Jerry.
We are too.
So I'm really curious, when did your love of music start? And we'll start with Linda.
I started at 6. My uncle was 12 years older than me and played the accordion so great. And it's just happy all the time when he played and smiling and enjoyed it so much that I begged to get an accordion for my Christmas that year. That's all I wanted. And so my parents got me the accordion. It was a little 12 bass. And I played in talent shows like Hannah Cole Company and stuff and would win. And it just kept edging me on to play more and more. And then my sister and brother came along and I taught them accordion, and we would go out and play trios for like different things that people wanted us to play for, different meetings, different fairs. And then when we got in the age where we could take instruments, I picked up the saxophone. I wanted that for my Christmas present when I was in the 4th grade. And then my sister wanted to play clarinet, and my brother took trumpet. They're younger than I am. My brother's 5 years younger and my sister's 3 years younger. But so we started playing instruments, and then we thought, well, we should have a band. So we got a bass guitar player and a drummer, which was his brother. And we formed the Jolly Jays Orchestra. It's a polka band where we traveled and cut 6 albums and played for the whole valley, the whole eastern side as far as Connecticut, Maryland. We traveled a lot until we started having families.
Oh yeah, that always gets in the way. What about you, Jerry? When did your love of music start?
Very young. I lived next to my grandmother, and her sister didn't live more than 2 miles away, and naturally there were a lot of Polish weddings. And music, it was always the centerpiece. And the band would be up there on the stage, and I just would stand next to the band off to the side, and I was always told, now don't touch the instruments. And it just like, the wedding back then would go from 6 to 2 in the morning. The people dance, having fun. And then, and it would also start the day before when they went for preparation. There would be music there the day of the wedding, and then the day after the wedding, there was more music. So And it just people were so happy involved with the music. And then my uncle lived next door. He played an accordion. And when it got to be close to high school, he brought my sister a clarinet, and then I got a trumpet and joined the band at St. John's. And then for 2 years after that, I played in the polka band. And then put the trumpet down for the next 35 years because of school, family.
And I think a lot of people do that. They put things down, they put their things that they found joy in, and they just go, that phase is over. But once you picked it back up, it brought renewed joy to your life, did it not?
Well, how I got back, and I still say to Alan Antelock, he bugged me for like 2 or 3 months. He kept saying, "We need a trumpet player, Jerry." I said, "I haven't played in 35 years, no." But he would not quit. He persisted and persisted. He wouldn't take no. He's passed on since then. And I always say, "Alan, thanks a lot." So now it's been 25 years later, and I'm still playing, practicing, driving my wife nuts, and hearing a trumpet blare in the room. Da, da,
The same note sometimes gets me.
But so you played in a band, and his brother played in your band. But
Yeah.
when did you two start playing together?
Not until we were married after our children kind of grew up.
Yeah.
So how did that come to be?
Well, we put the sax, he played the trumpet, and my Uncle Wally, the one that I, took after, he played the accordion, and we all got together for our daughter's wedding. She wanted a polka band. And so we practiced with that, and then we started having them come over, and we'd go over to his house and just play for fun. But I got into the saxophone because I graduated from Kent State, but I got a scholarship in bassoon. My senior year, I learned how to play the bassoon so I could get a scholarship, because my band director said there's a dime a dozen of sax players, and I got my whole college paid for. And then when I was in the marching band, the concert band, all that, and running home to play the polka band, I just put it down after I had my kids. I put everything down.
Yeah.
And then I went to this band that we're talking about at Shady Side. I hadn't played for 40 years.
Really? So tell me about the Shady Side Band, the community band. Where all do you guys play?
Well, go ahead. You know more than
Well, we play for a lot of nursing homes.
and get standing ovations.
We play for some community, like parks. We played in Blair. We played in Shady Side. We're going to be playing at the community hall in Shady Side March 5th. And we've played for the sisters at St. Joseph. They enjoy it. They even dance along with the music when we play for it. So it's joyful that we can come to people and particularly bring back memories for these, because we play the oldies that they grew up with, and so they're familiar with the music that we play.
Do you think that the music keeps you young at heart as well?
Oh, yeah, because we have to practice.
And we play for a church, Easter and Christmas, and it makes a difference in just singing. And we play Joy to the World, and Easter we play Christ is Risen Today, and it adds to the
Choir.
to the purpose.
So let me ask you this. What would you say to people who have had passions in their youth that maybe put them down once they started families or for what other reason, but they still think, I might like to revisit that? What do you think on that? Do you advise them that they absolutely should? Or
They should, because it's in your blood. It's just like riding a bike, you pick it up again. And it keeps something ahead of you to look forward to.
And it helps to have a companion who can support you and encourage you in what you're doing. And even a friend, knows that you have done something in the past, and hopefully they say, hey, why don't you pick up, like, say, carving, or people like to put old cars together, or whatever it might, painting, or whatever it might be. Just start. Don't delay. We don't have that many more days.
No, we don't. We don't. So what would you say your philosophy on aging is?
Keep moving.
I don't think about it.
No?
No. Today comes up, and
Challenge yourself.
it's a day, and you live it. I don't think about age. It doesn't. I don't know. I don't think about it at all. I just do. Today,
We're too
this
busy
is
to
what we
think
gotta
about
do, and
aging.
let's move on.
So let me ask you, if you could give advice to people of younger generations about what the aging process is like, what would that be?
Eat healthy,
Yeah.
exercise, follow your passion.
Yeah, these are all good.
Those are great pieces of advice. Absolutely great pieces of advice. And what do you say about the community aspect of being with friends and going out and seeing other people? Do you think that's a good thing too?
Oh, very definitely. I mean, the people that we have in our community band, there's probably 25, and we've had people play up to the age of 91, 92. Our oldest right now is 89, and he's been playing for 70 years.
Wow.
But we have also junior high students in the band and students that go here that come and play. So it's
We have
a
a
wide
variety.
range.
Right. Keeps you young at any age.
Right.
Yeah.
And so we have a purpose, to practice there. And then you meet the people and you talk about them and their families, and you have another family, actually, with the community band. It's another family. And the director, she is very patient. She tries to pull us, get this thing all together, and everybody works for that purpose, like putting a puzzle together. You look for that right piece, and when it all blends, you have something to really look at and say, hey, we put it together, we've done it.
Yeah. Wow. Well, thank you very much for all your wisdom and sharing with us. It was a pleasure to talk with both of you.
You too.
Thank you.
Thank you for having us.
Remember, we feature someone aging awesomely in every episode. So if you are retired and living a vibrant, exciting, meaningful life, we just might want to feature you. Or maybe you have a friend, family member, or neighbor who would be a great fit. We'd love to know more.
Send us an email, give us a call, or message us on Facebook with your suggestions. Who knows? You just may be featured in our Aging Awesomely segment on For Mature Audiences.
And that's going to do it for this edition of For Mature Audiences. We hope we were able to provide you with some information that you found to be interesting and helpful.
That's exactly right. And since this is a show to inform, educate, and inspire, we'd like to know which topics that you would like us to talk about and for you to learn more about.
So if there's a topic that you'd like to see us cover, we want your input. After all, we're here to serve you.
Send us an email and let us know what you would like us to feature on the show. Our email address is right there on your screen. It's info@iccare.com.
Well, thanks for watching, everyone.
And we'll see you next time on For Mature Audiences.